A warm welcome on World Mental Health Day from Lissun. It's an amazing feeling personally from me to have such an eminent panelist on such a great day. So I'd like to welcome them all and I'll introduce them a little bit. So as you know, the theme for this year is mental health care for all. Let's make it a reality. And we are focusing specifically today the role of family. And we'll talk about it. So our first guest is Dr. Aruna Kalra. She's founder Mums Clinic, and she heads the Department of Obstetrics and Gynecologist at CK Birla. And she has been renowned gynecologist and worked with many other hospitals and provided her expertise in many other places. Her areas of interest include minimal invasive gynecological surgeries, gynecological surgeries, high-risk pregnancies, and vaginal birth after cesarean. She has previously offered her expertise in popular institutes, including Paras Hospital, Artemis Hospital, and Apollo Cradle. So, welcome Dr. Aruna Kalra today.
Thank you. Thank you very much, Krishna.
Our next guest is Dr. Imran Noorani. He's an assistant professor at GRIPMA, the Gangaram Institute of Postgraduate Medical Education and Research. He's also consultant chief psychologist at Child Development Clinic, Center for Developmental and Behavioral Pediatrics, Institute of Child Health, Department of Pediatrics, Sir Gangaram Hospital, New Delhi, India. From the last 10 years, Dr. Noorani has intensively working in the field of disability, serving the population, right from awareness, social inclusion, screening, diagnosis, intervention, advocacy, and rehabilitation of children with developmental disorders, emotional instabilities, and psychological problems. Welcome, Dr. Noorani.
Thank you. Thank you so much.
Yeah. So our next guest is Mr. Paritosh Sharan. He's an experienced and certified executive and life coach, OD consultant, counselor, and a motivational speaker. He's a master practitioner and trainer of NLP, neuro-linguistic programming. To take forward his mission, he founded Transhuman Consulting, a company dedicated for the transformation of individuals and organizations together for blissful tomorrow. He has over 22 years of rich corporate experience before that in leading organizations such as Tata Steel, Satyam, Oracle Corporation, and many more. And he has done more than 700 hours of coaching for various individuals and executives at various levels. So welcome, Mr. Paritosh.
Thank you, Krishna.
And last but not the least, Dr. Preethi Singh. She's a trained and licensed clinical psychologist and psychotherapist. She has been trained from NIMHANS, Bangalore. She is registered with Rehabilitation Council of India as a member of American Psychological Association. She has an experience of 20 years in the field of mental health. She has expertise in psychological testing, counseling, and psychotherapies for children and adolescents and adults for psychological and psychiatric issues. She's associated with Lissun as Chief Medical Officer, and she's also the founder of Seamless Clinic, and she's also a senior consultant at Paras Hospital and also at MDI Gurgaon. So welcome, Dr. Singh.
Thank you so much, Krishna. Such a warm welcome.
Yeah, thank you. Yeah, we can start the panel. So my first question is to Dr. Kalra. As you know, the theme today is about bringing the role of the family, and then at Lissun, when we were thinking about it, so we wanted to have people from different, not just parts of different specialties, but also different parts of human life, right? And as a renowned OB-GYN and laparoscopic surgeon, you meet and treat scores of women. So to start with, what according to you are the key mental health issues with women and how they impact their physical health?
Yes, Krishna, it's a very, very important issue, and it's really, I would say you are doing a great work, because whether you yourself are aware or not, mental health is totally neglected in most part of the world, but definitely in India. We do not consider mental health as mental illness or anxiety or stress as something which should be addressed. And in women, most of the time, when I was working in government hospital, I should say, there are so many examples when actually there was stress of pregnancy, stress of menstrual bleeding in younger girls, and every stage of life. Adolescent girls were having menstrual problems, acceptance for that they have started menses or they are growing and their bodies are changing. Uh, yes, 90% girls would be normal, but then there would be 10% girls who would feel that they are uncomfortable with their body shape changing. And that is one age where there is a transformation and they are under stress. They do not want to eat, they do not want to come forward or meet people. Second is during pregnancy. During pregnancy, there is hormonal upheaval. They are going through many changes, not able to sleep properly, anxiety about pregnancy, nausea, vomiting, backache, fatigue, and all those symptoms can overlap with actual anxiety and stress. Again, they are family doesn't consider that is should be addressed, and this is like it's a normal physiology. Pregnancy happened to everyone of us, and there is nothing serious or there should not be anything which should cause stress to you. So there is another transition when females get stressed and chances that they might go into depression. And again, then postpartum period when suddenly hormones are dropped down, estrogen, progesterone are not there, and sudden change from estrogen, progesterone to prolactin, and suddenly a girl has been transformed into a mother with lots of responsibility over her shoulder. Like she has to feed her baby, she's in pain of stitches, and everywhere around relatives have lots of I would say that they start comparing her to themselves, like they were absolutely okay with breastfeeding and she's not breastfeeding, or she's not able to take care of household chores, and so many extra things are she's burdened with. And that is the time when they go into postpartum blues and depression. So because we in female or in women's life, there are many changes from adolescent to pregnancy to menopause, breastfeeding, when we are actually facing problems with hormonal changes in our life. And those are the changes when we are vulnerable, when we are fragile, and we might fall into blues or depression. And that's when yes, as you asked me, where do you think I am I'm concerned? Yeah, I'm concerned at every level, when adolescent girl comes to me, or a menopausal lady. Preeti, Dr. Preeti, you want to say something?
Yeah,
No,
I just
think there was some noise. Please continue, Dr.
Yeah.
Kalra.
Okay, so in our OBGYN practice, we feel and now there's another example like menopausal. I just now said that. Another is when we have infertility issues. So there's a whole lot of 1/3 or more than out of 10 girls, if 7 are able to conceive, 3 are not. It's quite a burden on themselves nowadays, because they are marrying at a later age, they're planning at a later age, target oriented approach towards pregnancy, and that is why they are more stressed. One thing, they do not have time for themselves, like partner, they do not have time for with partner, and all these stresses, infertility stresses, again are causing burden of mental health issues in women's life.
No, I think that's so great to hear from you. And what generally we do, and I was reading this very pertinent article which came in Economic Times very recently, this week itself, that we have separated the mental and the physical, but the human organism, the way, we have evolved, we don't have a separation between the two. And so good to know that the life stages, and like, maybe on the other side, I would say, I can understand through my wives or even a daughter or mother, and this, they all go through different phases, and that is so much associated with the mental health. Now taking it forward, and as I said that the topic today is role of family, moving towards the child. From the very beginning, and I had some very deeper discussion with Dr. Noorani in his chambers about the child, and I have two of them myself. So Dr. Noorani, as a leading clinical, as a leading person in helping and solving for children with development disorders, in your day-to-day activities, what are the key mental health issues that children face and how they impact their physical health? So we talked about women. Now we'd like to know more about the child. Sir, you are on. I'll just, if you can unmute yourself.
Thank you, Dr. Krishna, for inviting me here. So I'll start with a little background of what statistics say. And we know that children and adolescents in India form almost 40% of the Indian population. That is amounting to almost 300 million. And 14% of the disease burden overall is because of mental health, is because of the neurological and substance use disorders. We know that the prevalence of mental health in adolescents is almost 7.3%. And at any stage of time, 8 to 13% of children or adolescents need mental health services. So this data is for typically developing children, which is like normally developing, who don't have any developmental disorders and all. Now, what we do is we do a lot of early intervention, diagnosis, and rehabilitation for children and adolescents with the neurodevelopmental disorders, behavioral disorders, eating disorders, or emotional disorders, what we call. Neurodevelopmental disorders is like autism spectrum disorder, intellectual disabilities, learning disorders. Emotional disorders are like depression, anxiety, and etc. And then behavioral disorders like ADHD and all. We know that these children and adolescents are already suffering, and they are already taking care of the burden that we as typical individuals are putting them through, that they have to perform as per some expectations set by the society or set by the academic systems or by the typically developing peers. Now, when we see that they are already having this concern that they are not able to take care of themselves as they are not competing with the rest of the peers, this lockdown and COVID times has added exponentially to their problems. How? Because, for example, if a child with autism spectrum disorder is there, who is not able to communicate his anxieties, or who is not able to communicate his needs and wants, and that child has been confined in the spaces inside the house, how a parent or a child is going to cope with that? In addition to that, we know that in COVID and pandemic times, demands have been more than the resources, isn't it? That there have been a lot of financial problems. There have been limitation of resources, and social support was not there because one family could not meet their other family who could have been a social support for them. And then we have the relationships, like social limitations in interacting, recreation opportunities were not there. All these things, to understand the impact on the mental health, we have to understand the impact that has been through the family unit. For example, unemployment, it has been indirect as well as direct. Indirect through the family units because of the financial concerns, because a parent had to take care of the child at home as well as cater to the professional services. Then there has been a dip in the academic performances and in the education system, which has impacted whole of the community. Now, coming back to this, what were the concerns that these children are having in addition to their own developmental problems, where they have been categorized into emotional problems, behavioral problems, then cognitive problems, physical health, which you just described, that, for example, sleep deprivation is there. For example, obesity is there. They have been eating, they have not been physically moving around. And then there have been the developmental concerns. In terms of this behavioral concerns, there has been a lot of irritability. There has been a lot of throwing of these temper tantrums. And then there has been increased use of gadgets, which everybody of us knows that the trend or the guidelines for it has lately changed. But the children who are already into neurodevelopmental disorders, and screen time is the major stressor for them, it has increased the problems exponentially. Anxiety, palpitations, you will see normal adolescents coming to us with the panic disorders, and then somatic complications are there. And one important thing in cognitive impairments or cognitive development was that this excessive fear of a parent, of a mother or a father, that will they be able to will they be fine or not? This separation anxieties were very high. And in addition to that, the last thing which was there was a huge decline in the academic performances in the lower economically financially and economically background sections, because they were not able to get the access to the academic services. Overall, this violence, aggression, anxiety, depressive symptoms, use of gadgets, abuse was seen a lot in household chores, because a child with special need was not able to understand why he or she has been confined, and they would be obviously expressing differently in their behaviors, which was not taken well by the parents. So it has been a lot of mental health impact in this pandemic on these, which will, Dr. Krishna, go through their adolescence, because whatever experiences and or the traumas a child faces in first 0 to 5 years of life is going to make and shape the personality of the child in his coming years.
I think this is very helpful. And just when both of you, Dr. Noorani and Dr. Kalra, that you were talking about, in fact, when we started this week, one of the mom asked this question, which combines, I think, both of the things, right? That, how mothers can cope with children at home. It is becoming difficult. And as family, family is the most important and the strongest unit, right? We say that family is the first school of civil life. So that's these are very pertinent things that you are sharing. But anyway, moving this forward to Dr. Singh and going a little bit on the relationships, right? You are a leading clinical psychologist and has done immense work in the field of psychotherapy. But you also, have one of your expertise is psychosexual intervention. So Dr. Singh, can you tell me a little bit about the role of the family in it, and how does it impact the mental health of the individual and the couple who have psychosexual issues? Because these all are interrelated, like kids,
Oh, yes,
parents,
absolutely.
mothers, right? And that's the idea today, to understand in a limited time about these things.
Right. So I guess a very important factor that we are talking about is family. And before I really come down to your question, I want to add up that the role of family in any kind of mental health intervention is immense. And, in a place like, in our country, where the family still is a very, very important structure. So, they're still very consolidated as compared to the Western world, not to reduce the role of family out there. It's very important that the family should understand what is a mental illness or mental health. Otherwise, the whole intervention gets sabotaged. We see the dropouts happening. We see the follow-ups are not happening properly. And unless and until the family is convinced, the treatment cannot start.
In fact, I'll come to you, to all of you actually, towards the end.
So that is the gravity we are talking about here. And there's a whole step when after you diagnose a patient, you have to psychoeducate the family first. They have to understand whether the person is having anxiety or depression or schizophrenia or bipolar mood disorder, or with kids, what it is learning disability, or, it's ADHD, or it's autism, or mental retardation, or borderline. So there's so many categories. How does a family differentiate? उनके लिए होता है कि भाई ये कर नहीं रहा है, जो इसको करना चाहिए वो नहीं हो रहा है. Unless they understand that there is a valid reason and there is a complete, genuine condition, which is like even biological in nature and psychological and social, the whole act does not come together. So now coming from that part to the top, the issue that you have raised here, Krishna, I think we were talking the other day. Mental health is a taboo and sexual health is a double taboo. So how do we bridge this together, And we know how our environment is while we are growing up. Even if we recall ours, we have barely spoke to our parents about any of these things. Directly to सवाल ही नहीं हुआ, किसी ने approach नहीं किया होगा. Indirectly, mom ने कुछ बोल दिया, किसी ने कुछ समझा दिया, तो थोड़ा बहुत menstrual cycles के बारे में वो discussions हो गई. But that's not enough. Sex is not just about, you keep bridging all the gaps on your own. So what I see, I see a lot of couples coming to me from maybe semi rural background sometimes and rural background sometimes. कि भाई marriage consummate नहीं हो रही है. We are not able to come, and then the whole onus lies on the man. He has to do it. He has to fix it. Nobody understands what is the problem. Now whole families are involved here. Now the couple has to perform for the family. It's like that. Every day you have the girl side of the family and the husband side of the family checking onto each other. What is the progress? So can you imagine the whole intimacy, which is for pleasure, now it's like a test. And it's not just happening. So that is the role of the family we're talking here about. So you can imagine the plight for the husband and for everyone for that matter out there. So it's very important that the family understands that. And moreover, then I have couples, when Dr. Aruna said about, infertility, couples going through infertility. Infertility these days is directly understood as psychosexual or sexual disorder. If somebody is having infertility, the man is important. That's not the case. How do you break that understanding amongst people and vice versa? मतलब वो तो है ही कि आप important अगर हैं तो आप perform नहीं कर सकते आप मतलब then your infertility is there for that matter, and that distress is also immense. Now every time either sometimes the doubt goes on the girl because you don't know the exact situation, that who is responsible for what is the exact cause of it, because the infertility of so many kinds. So that again the family creates a pressure. Of course the couple is having their own struggles. Explaining every day to the mother-in-law is another challenge for the wife. They don't know how to make them understand. You don't have the vocabulary only to make them understand. So all of this, when it comes together, it is quite a complicated situation, because हमारे पास तो couple आ रहा है या फिर individual आ रहा है, in-laws or parents वो तो नहीं पहुंच पा रहे हैं, but they're having such an important role here. So I guess that's where I would like to leave it. That family is of utmost importance to understand all the problems. They need to be roped in if the outcome has to be better for us, especially in mental health. It's unlike the biological condition कि मरीज आया उसका treatment किया और वो ठीक होके चला गया. I'm sure Dr. Aruna would agree with that part of it. But when it is about the entire gamut, then it becomes quite challenging for us. Yeah.
I think Dr. Singh, we had immense discussion on these topics, and I'm enlightened many times on this. But I really liked one thing that you said today, the vocabulary. And even at Lissun, we struggle sometime to talk about it, right? So I'll take this forward to Mr. Paritosh. Sir, through your company, and you are a coach and psychologically trained also in NLP. How do you play with this vocabulary, and especially you with the executive, so-called executive? I was executive, let's say 3 months back in a company. How do you enable a far greater understanding of who the person is, right? And so for doing that, do you see an individual as an individual, or his or her integration with the family? And how do you facilitate, again, I will use the word, that vocabulary to talk about the mental health to him or her? I think you are on mute.
Thanks, Krishna, for this beautiful question. And I am not dealing with cases like we have the great clinical psychologist here. I'm looking at all of these from a more systemic point of view. And there are a few things I'm going to share on this. I would like to show you one matrix, okay? And with this, I would like to, can I show this to you? Is it visible to all of you?
Yeah, please.
Are you able to see this?
Move on. Yes.
So just look at this one. I want to use this matrix. You see a human being as a social animal. We all have a need to be related, okay? There is an inherent need for us to get related to a larger system. This works at the atom level, this works at the individual level as well, okay? This is an inherent need. Then as a human being, we also have a need on the just the opposite side to go inward, means evocation, right? This is very, very important. Evocation means something that I want to explore myself. This is an extension of me, and this is a inward journey. But then there is another very strong need, competing need. We want to be self-expressed. Every element in this universe wants to be self-expressed. And on the other side, there is also some inhibitions which creates a boundaries. These are there. So look at this matrix very quickly. I'm just going to, what will happen if you have complete self-expression and complete relatedness? It's like a courtship kind of period, honeymoon kind of period, when people have not gone in, you are not married yet, but you are just enjoying that relationship. Complete freedom and no commitment, right? Then comes to the second, where some amount of inhibitions are brought in, means now two people are married. And married means now one person is husband, another person is a wife. So there is a role, significance of a role, and role has boundaries. So here there was no role, now there is roles. So there is a second. The third, this is where complete evocation is there, means my inward journey is there fully, and I'm fully self-expressed. I'm not bothered about any damn thing. I call it Zone of Kabir, okay? So it's like a fakir, you are not bothered. And there is another zone here, the fourth one, where I'm taking extreme points. Complete evocation is there, but there is complete inhibition. And I call it, this is the zone of psychosis, okay? So this is the matrix I use in many, whether it is, you call it organization. So this zone, second zone, is where organization structure comes in. Family is also an organization of meaningful relationships. This is not meaningful relationships. This is the meaningful relationships. You get that? So when you asked me, Krishna, this question, so I had this, so I thought I'll show you that family is a kind of an organization. Just like you are running a new company, let's say Lissun. Now many people have come, and everybody has to have a role. If you don't have the role, then people cannot work. So family is also a role. I look at it from 2 points of view. Number one, the very fundamental definition. What do you mean by family? Family is just not an English word. I was just looking at, there's one small experiment that we did. There's one small, there's a child around 9 to 10 years. They were called to draw a family, and they have to do it through the chart. You know what he did? Me, my dad, my mom, my doggy, family finishes. There's another child. Me, my dad, my granddad, my daddy, my mummy, my nana, my nani, my mausa, my mausi, and other side, sabji wali auntie, rickshaw wala uncle. And the child kept on increasing. We have to say, no, time is over, stop it. Now you tell me, these two children are growing up. How they will connect, what they will consider as a family. So we look at first definitions, what idea I have for the family, because that idea becomes the most fundamental thing. How do I connect with my ecosystem, and who do I call it my family? That's number one. Then number two is, family is a family. People talk about functional families and dysfunctional family. I'm yet to meet a family which is not dysfunctional, okay? So all the families are like that, but the nuances are quite different. But one of the best way of dealing with is what, Krishna, you asked that question, right? Is going within and finding how do I connect, because family is nowadays, it could be source of your strength, but source of problems as well. And how do we define? That's how it is. So the real question is that, how do I look at myself? How do I define my family? Who I really consider my resources, and who I consider as my stressors, And then what should I do so that I develop a relationship myself first, so that it starts translate into relationships outward. Because this has been, I think all of you know that this was completely, it has been decoded that how the upbringing happens, the 7-year cycle. We will call it biological methods, where every 7 years you will see there is a development. There is a psychosomatic points, I would say, markers in the lifetime where something triggers. I think some gynecologists here, they know it, right? We had in our Indian system, there's something called solar sanskar, right? If you look at those all solar sanskar, they were exactly placed at a time when there were the major psychosomatic changes were happening either in the child or including in the mother. And you know, corporate times, it is like this, Krishna, when we were being what do you call, promoted to a new position. When somebody is getting promoted to senior level, so we are hired at times to do executive coaching and counseling and something like that, mentorship, right? I'm just asking, until unless we had those old traditional where people were actually prepared for it. Because remember that in South, there is a tradition when a girl has the first period, right? So there is a function around it. All relatives and everybody, so that such an occasion is converted so that girl child don't have to live in a stigma. And there is a social acceptance around it. Just imagine what will be the psychology. And there are other girls who have to hide behind it. Like that, that was the kind of a system that we had. So when a girl child, let's say a woman becomes a mother, and what a huge change in the identity of a woman when she becomes mother. It's complete change. It's more than a promotion to a new role. But what training we have given to the women? Have we prepared them psychologically? Or they one day simply they become wife, another day she becomes a mother. Even I'm saying, even as a man, which you suddenly become one day father, right? And you don't know what to do with it, how to deal with psychologically. And we have not looked into those kind of things structurally. Family structure. Another, just one point I will say, and I'll stop here. Neurologically, and thanks that many medical professionals here. Neurologically, we have grown the way we have evolved. Our rate of evolution, what has changed in, let's say, 1,000 years, now changing in 50 years. Okay. So our neurological, I would say, genealogical disposition is not attuned to take on the kind of psychological or the environmental changes which is happening. Look at the family structure. Amount of change it has gone in last 20, 30, 40 years is huge. And genealogically, are we in a position to hold on to this? So this dissonance within at the genealogical level, it has been tested. For example, you know, people who were in during partition, those families who suffered, their third or fourth generation living now has trauma, psychological trauma they go through still. It has been now proven scientifically that these traumas are continuing, has a genealogical impact, right? So last 30 years, I'm just giving you one data. Like in 1996, 73% of the kids lived with two, these are US data. 1960, 73% of the kids lived with two parents who were in their first marriage. And by 2014, that percentage dropped from 73 to 46%, right? By 2014, 15% of the parents were remarried, right? By 2014, 26% of the children lived with single parent, right? I mean, can you imagine the impact it is happening on the child and the individual in the society? So I look at Krishna from a very, very holistic and from a systemic, not holistic, I'll say the systemic point of view, that how are these factors actually working on the individual? And then I work on that, how do we take on? So that's my approach. And during pandemic time, I tell you, people are locked in. They are locked in. Evocation is happening, but they are all in inhibition. So they are all cooking in a pressure cooker. That's the system.
Yeah.
Right.
Okay, Krishna, can I add something? I think Paritosh has really brought it up very beautifully about the whole systemic approach and the family. Now, just to take it just a little bit, so we actually do family therapy with the systemic approach, because a lot of times when in the mental illnesses, a lot of symptoms which a patient presents oneself is playing a function in their lives. It's creating kind of a homeostasis in the entire family dynamics. So we are doing family therapy separately along with the individual therapy, wherein unless and until those dynamics are taken care of, we will not have the psychiatric symptom go away. So that's the role of family therapy from the intervention perspective. So I guess, so it's very important for a lot of disorders. Family therapy, of course, family gets one person, to the doctor. But they have to understand a lot of times the entire gamut needs an intervention and a proper intervention simultaneously. In fact, in Imran, we have a family therapy unit. We have places where family comes and stays for months together along for the entire treatment part of it. And we do it here also, but we don't have the stay facility so much. But that's the role of the family in terms of mental health again, which I would like to highlight here. Yeah, over to you.
That's a very important point.
Yeah, no, thank you. Thank you, Mr. Sharan and Dr. Singh. Yes, systems and structures. I definitely understand. I'm a trained process engineer. All other things I've done later on. So I understand those processes quite well. And coming to next part of our discussion, and we understood the impact of family on so many different aspects. Coming back to Dr. Kalra. So we discussed about symptoms, I think Sola Sanskar and many other stuff. And you started with different stages a woman go through her life and how it impacts her mental health. Ma'am, the question that I have is that in India, the awareness is anyway a big problem, but even now, since so much talk is happening, acceptance is just next level. It never happens with me. So maybe a mother, I was talking to a pediatrician, giving a very, very short example, and she was telling me a lot of postpartum depression patients comes to her because they are not able to handle the kid, and that time they are, going to the doctor and talking about that. So it's so much there. And so just want to understand from you that how do you convince or, talk to a patient that, you need a help, which is not just coming from their doctor who is treating their physical health, but also, let's say, from a trained psychotherapist or a psychiatrist.
Yes, Krishna, as everybody like Paritosh and Dr. Preeti, everybody is stressing upon family, and this whole discussion is about family role in identifying one thing, not stigmatizing. First thing is accepting, identifying that yes, it is an illness, and then going forward with it to doctor. So yeah, because in for adolescent girls or postpartum depression or blues first come to me, and I have to detect whether the lady is going into depression. And many a times I've asked Dr. Preeti to please look into it, that she is not feeling up to it, not accepting her motherhood, or not able to feed her baby. See, first thing very important is acceptance, and how are we helping them to make them understand that this is an illness. Okay, this is actually mental illness is an illness. So now what we have to do here, what has till now, nothing has happened. Okay, nobody has improved anything, neither from government point of view nor not in public sectors. Or now we have a very, very big tool in our hands, which is internet, media, and we know that lots of advertisements which are coming up nowadays. And we have seen one advertisement in which a girl is playing cricket, and Sardarji is coming with Cadbury chocolate. So दिस इज लाइक है ना अमेजिंग कि आप गर्ल चाइल्ड को प्रमोट कर रहे हैं। ऐसे ही आलिया भट्ट की एक है कि मैं दान की चीज नहीं हूँ, जब शादी में वो बैठी हुई है अपने। तो हर एक चीज बहुत ब्यूटीफुली एडवर्टाइजमेंट और मीडिया और इंटरनेट के जरिए हम लोग कन्वे कर पा रहे हैं। और ये मेंटल हेल्थ का भी वी हैव सच अ बिग टूल एंड लिसन इज डूइंग सच अ ग्रेट जॉब। हम लोग इंडिविजुअल लेवल तक जा सक रहे हैं। हमें पता है कि मोबाइल रिक्शे वाला भी है, सब्जी वाला के पास भी, और इंटीग्रल पार्ट ऑफ एवरी बिजनेस है ना। उन लोगों के बिजनेस का, उन लोगों के लाइवलीहुड का भी पार्ट है वो। तो they would use mobile, they are using every day, and now we have an app which is Listen. If they have any kind of stress or something, they can do so. इसी तरीके से अगर हम ये अवेयरनेस फैलाएं तो बहुत जल्दी, जैसे एक इंडिविजुअल डॉक्टर मैं अपने पेशेंट को समझा सकती हूँ, और जैसे डॉक्टर प्रीति ने कहा कि मेरी पूरी फैमिली को 9th मंथ पर बुलाकर एक सर्कल टाइम किया कि ऐसे ऐसे these are the things she would go through, लेबर ऐसी होगी, आपके जमाने में पेनफुल होता था, अब पेनलेस डिलीवरी भी है, सो लेट हर हैव दिस पेनलेस डिलीवरी मेथड्स जिसके लिए मेंटल ब्लॉक है। उसके बाद ब्रेस्ट फीडिंग के लिए उन्हें सिखाना पड़ता है कि आ जाता है, हर एक मैमल का आता है, इट वुड टेक अ लिटिल टाइम, हर एक का ट्रांजिशन इतना स्मूथ नहीं होता फ्रॉम गर्ल टू मदरहुड। और मदर इन लॉ को भी रोप इन करना पड़ता है, उसमें मदर्स को भी करना पड़ता है, तो एक फैमिली यूनिट को समझाना पड़ता है। ये चीजें पहले नहीं होती थी। गवर्नमेंट हॉस्पिटल में तो हम प्रैक्टिस में बिल्कुल भी नहीं ये करते थे कि वी आर नॉट सिटिंग विद फैमिली एंड हैविंग अ सर्कल टाइम एंड हैविंग अ चैट विद एवरीबडी दैट सी दिस इज गोइंग टू हैपन एंड यू शुड बी अकोमोडेटिव। But nowadays we are facing these mental issues at much larger level. The percentage is increasing, and that is why we are bound to do circle times. But as one individual doctor, how much I can do? But as you people have come in now, you are aware and you want to spread this awareness. I'm really hopeful कि ये जो चीज है, जो अवेयरनेस है कि मेंटल इलनेस को आइडेंटिफाई किया जाए, एक्सेप्ट किया जाए, उसको स्टिग्मेटाइज नहीं किया जाए, उसके साथ दे स्टार्ट फीलिंग, ये फैमिली को लगता है कि बहुत गलत चीज है, दे डू नॉट इवन वांट टू गो विद दैट पर्सन आउटसाइड टू अदर पीपल, रिलेटिव्स हाउस और कहीं पर भी फ्रेंड्स के, क्योंकि उन्हें लगता है कि ये एक चीज जो है हमारे को एक धब्बा है। वी डू नॉट वांट टू टेक दिस चाइल्ड और माय हस्बैंड और माय डॉटर और एनीबॉडी और माय पेरेंट्स फॉर दैट मैटर इफ दे हैव अल्जाइमर और शिज़ोफ्रेनिया और समथिंग, तो वो नहीं ले जाना चाहते, वो खुद भी कन्फाइंड हो जाएंगे घर में मगर उसको नहीं लेके जाएंगे। तो ये स्टिग्मा हटाना बहुत जरूरी है, और ये ज्यादा तभी हो पाएगा जब हम ब्रॉडर लेवल पे इस बात को स्प्रेड कर पाएंगे।
First of all, thank you for all the kind words about Listen. I think this is much bigger problem, and the reason for Listen to exist is to normalize and personalize mental health in India and beyond. And yes, this requires talking, discussion at multiple levels, multiple touch points, and that brings me back to Dr. Noorani. And in fact, whether there's a lot of questions coming from the child perspective, so you guys may have to stay a little bit longer today. But anyway, so that towards the end. But so same question, right? Just take it a little bit forward, right? You talked about specifically the whole pressure that is there on the child and how the things directly or indirectly, unemployment, pressure of the parents do come to the kids, right? And I think Mr. Paritosh was giving a family breakup stuff about US. I spent 8 years in US and I understand few things a little bit on the family structure side there. So, but how do you convince, let's say, the parents, because let's say child is going through some problem, but the problem essentially root cause lies in the parents' side. So, Dr. Noorani, how do you convince parents to take that help? Same question like what I asked to Dr. Kalra on the women's side, taking it forward to the parents of the kids. कि बॉस प्रॉब्लम तो आप पे है, आप करो कुछ, rather than बच्चे को तो ले आए हो, अच्छी बात है, but can't you do something about yourself?
Right. Krishna, actually, there are two approaches to counseling a patient and the child, because if a child is having a neurodevelopmental disorder, for example, autism, you will not be telling a parent that this is your problem, because it has to do with the brain development of the child in itself. But if you have a child who is who's socially withdrawn, or who is anxious, or who is having some panic attacks or something like that, then you go to the parent and you understand the history, that what kind of a social structure they are providing to the child at their home. The first thing is that most of the times you'll see the patients coming to you as a couple, but when you give them those psychological batteries to fill, they have a lot of discord. One parent will be accepting the things and the other parent will not be, and that happens in front of you. So there comes your role as a professional to make them understand. You know that there are stages of that being unaware, what Ma'am was just mentioning, that we need to make them aware. What I have seen lately in our clinics is that most of the people know about the problems now, because there's a good access to mental health services, and in urban cities, not in the rural areas. But once they get to know of it, they start I call it as information abuse, because they start reading so much about it that they stop thinking, and they are so afraid of the thing. For example, this autism, why it's coming again and again, because there has been a huge increase in the number of children that we see in our clinics. Once you use the word autism for a parent, and they are absolutely blocked, they can't think anything after that. So there are steps like being unaware of the thing. Second is the denial, and third is the resistance, that they'll be like, okay, I'm depressed, but I don't want to go on medications and psychotherapies. I'll be able to manage it on my own. Then after that comes that flackiness. I know that if I exercise and if I take care of my child and I will give him good support, अब हम घर पे लड़ाई नहीं करेंगे, अब हम abusive relationship में नहीं रहेंगे, मुझे लगता है ये ठीक हो जाएगा. And finally, it comes to the acceptance level. Oh my God, I am having depression, or my child is having depression, or he is having learning disorder. So we accept it. This is going to be a lifelong disorder. To do an intervention, we need to understand these levels, where your client or a patient or a parent is. Because unless and until you are not aware which stage they are at, you will not be able to counsel them. Now, the first step, how do you, there is a good question about how do you destigmatize these things, isn't it? I'll give you an example that when a parent comes to us at the age of 2.5 years of age, if a child is not speaking and we start evaluating the child for a neurodevelopmental disorder, we tell them that the child is not able to communicate. Why are you here? Because the first step is to let them speak. Most of the places, they have already visited some other places, and they are like that before we speak, there has been a diagnosis that has been thrown to us, or they have just labeled our child as that he is autistic. The first step is to listen. That the name aptly mentions it. This is the most crucial and important phase of any psychotherapeutic intervention, that you need to listen to a person. Second is that you need to show support, isn't it? Support is like misconceptions about autism, that they will be lifelong like that. Yes, it's a neurodevelopmental disorder. It is technically a lifelong disorder, but if you work on them early and intervene early, they can be fully functional. That is what we have seen in hundreds of children who are visiting us. I believe in something we call as that, we call it like be sensitive of timing and place. We are always emotionally sensitive while we are talking to a parent or a patient, but we are not physically sensitive, isn't it? When, where, if you are in a clinic and you are having some other clients there, because there is a huge rush in the clinics, you might not be finding a space to talk to a parent alone. Physical sensitivity as well as emotional sensitivity is of crucial importance to gain the confidence and to gain the trust of a parent, so that they understand, yes, he is on the same side as we are. One more thing is that if you are having a conflict, if a parent is saying, no, there is no problem, and you know that there is a problem, you cannot confront them just like that, because then you have lost it. The second stage is what I call my parents, and that's true, that to a mother and a father and me, we are on one side of the table and our child is on the other side. When you work as a unit, definitely then psychotherapeutic interventions or neurodevelopmental interventions do magic to the kids. So coming back and winding it up is like that it should not be a conversation of this type, that there are three people and you are asking a parent that, oh, okay, tell me, how do you feel? and tell me, what do you think you are going through? They know what they are going through. Their problem is this only, that they are not able to put it in words and tell you how do they feel. There has been a child who has been asked that there is a 6-year-old child who has been depressed, who has been diagnosed with depression, and he has been asked, how do you feel? How do you expect a child at the age of 6 years explain things, who is socially withdrawn, who is having a learning disorder, who doesn't know why this thing is happening with me? So showing support and being sensitive to timing and place, involving family. Most of the children who don't reach us 0 to 5 years is the best age of intervention for a child to get over the communication problems, learning problems, and social things or emotional instabilities. They don't reach to us. Why? Because the first contact is a pediatrician, Krishna, for all of the children, isn't it?
Yes.
And if a pediatrician is sensitized, and if there is a query by a parent at 1 year and 6 months of age that my child is not speaking meaningfully, this becomes the responsibility of that treating pediatrician to mark it as a red flag sign and refer or counsel their parent at least that please watch out for any developmental disorder. And coming back to this concept of this family as a unit and all, what I personally believe is that it is single individual at a time, isn't it? One person who is suffering and who is going through the problem, make him the target or make him the priority number one, start communicating with that person. Passive interventions are family interventions, wherein definitely family has a big role, and family has to creep in, but you cannot leave a severely depressed individual and start calling family to take care of him. Do active interventions with an individual first, and once you will see that there is a definitive change in the person, family automatically comes in. When the child at the age of 3 years, after 6 months of intervention, starts speaking dadu to dadu and mama to mama, they're like, yeah, it's working. Show some results to them. And about what Dr. Preeti just mentioned, that we have a unit of family counseling. Similarly for children, because grandparents usually, why do they deny problems? Is not they don't know about it, is mostly they are afraid of it. Just break this myth of being afraid of developmental disorders or psychological problems, because they feel that it's a long-term thing and it's not going to be fine. It can be taken care of if early interventions are given to these children and young adolescents.
I think that's pretty comprehensive, Dr. Noorani, and that's actually, I think, brings to the towards the later part of our discussion today. See, we talked a lot about family and how the role they play even to a child, or whether it's a 9-month pregnant woman, and as Dr. Singh talked about her Niman stage and other stuff, right? So now moving towards a little bit of the solution, and this is actually kind of a common question that I want to put to the panel, and let me again start with Dr. Kalra on this. How can we truly make family an advocate rather than the blocker? And we touched upon this, right? At many places, how family, let's say 0 to 5 years, they don't bring it, right? Mother-in-laws and father-in-laws or whatever, right? It works anyway, right? And relationships anyway. So how do you truly make family an advocate rather than the blocker for a person to seek mental health? Because essentially one thing that binds in the family, functional or dysfunctional, right, is the love. This is the strongest unit, right? And those societies where this unit is really thriving, they thrive as well, right? So just want to understand, how do you can make family an advocate? You have such a long experience, rather than the blocker, and you might have cases where you have turned people around, right? So would be great for our audience to know a little bit more about it.
Yeah, Krishna. So we are fortunate that we are in India, okay? And as somebody said that in US, and you were in US yourself, you know that US have mostly nuclear family fashion, okay? And in India, we have joint family, and joint family means okay, rickshaw wala bhi hai, press wala bhi hai, or dadi, nani, masi, mamus, everybody is in the family. And we know that we are so dependent upon them we have very close knit units. We can leave our kids with them for 2 months, summer vacations and all those things. So that's where the beauty lies in. We have close-knit family. We meet for functions. We meet for festivals and every now and then. And if a doctor explains to them that this is mental illness and it has to be supported by family. First thing, we do not have many mental like many psychiatrists or clinical psychologists. We absolutely cannot, we cannot cater to the population who is suffering from mental illness. So if we, for one thing, we do not have that much facility that 101 or over 1,000 we have one mental psychiatrist or clinical psychologist for 1,000 population. We do not, we cannot afford that. And then that's how family unit brings into picture, like we bring it into picture. अगर फैमिली यूनिट ही ट्रीट करती है जैसे निम्हांस में करते हैं या और हॉस्पिटल्स में, वही ट्रीट भी कर सकते हैं. It becomes so easy if my spouse or my parents understand that this is like, if my parent is having Alzheimer or schizophrenia, and if I understand that, if as a family, my spouse, my kids, my co-sister, everybody, सारे लोगों को ये समझ में आ गया कि ये इलनेस है, ये डिफरेंटली बिहेव करेंगे, इनको सपोर्ट चाहिए. और आप ऐसा नहीं कर सकते कि एक इंसान उस एक बीमार इंसान के साथ पूरा टाइम रह पाए. पहली बात, वो खुद भी मेंटली अनस्टेबल हो जाएगा उसके साथ रहते रहते. दूसरी बात कि वर्किंग होते हैं आप, फाइनेंशियली यू नीड सपोर्ट, तो आप अपना काम छोड़कर भी नहीं रह सकते, यू नीड सपोर्ट. जैसे आप एक बच्चे को संभालने के लिए आपको ग्रैंड पेरेंट्स की भी जरूरत होती है और आपको हेल्प की भी जरूरत होती है, सेम वे यू नीड फैमिलीज हेल्प फॉर a mentally ill patient, and that's where support of everybody is needed. If I'm going somewhere, I need my partner's support or my mother-in-law's support to take care of my child who's mentally sick or anybody. तो यहाँ पर अगर हम फैमिली यूनिट को अच्छे से समझा पाए कि ये एक इलनेस है जो कि आपके सपोर्ट से ज्यादा जल्दी ठीक हो जाएगी, अलग रखने से उसे बिल्कुल भी नहीं ठीक होगी, मेंटल असाइलम में डालने से नहीं होगी, या उसे अलग से एक इंसान ट्रीट करे तो वो खुद एक इंसान बहुत ज्यादा बर्डन हो जाएगा, मेंटली सिक हो जाएगा. सो आई थिंक एडवोकेसी तो खैर करानी ही पड़ेगी. जैसे अवेयरनेस आएगी, जैसे हम लोग उनके साथ बात करेंगे, वी वुड बी एबल टू मेक देम अंडरस्टैंड, एंड वी हैव टू अंडरस्टैंड दैट फैमिली सपोर्ट के सहारे ही हम उन्हें ट्रीट कर सकते हैं. हमारे पास उतने क्लिनिकल साइकोलॉजिस्ट नहीं है, उतनी बार हम जा नहीं सकते हैं, अफोर्डेबिलिटी भी नहीं है लोगों की कि हम उस तरीके का ट्रीटमेंट करा पाए.
I think that's true. That's true. I think Dr. Noorani was saying something.
Yeah, actually, I'll add on to this that there is something which is like information is available with everyone, isn't it? The concern for advocacy can be this: there is a block because there is something which is called giving authority, decisions on part of a parent, on part of a mother, or on part of the child. Balance between this information and giving authority to them is very, very important for this destigmatizing and advocating things. For example, there are grandparents who are telling a parent that don't visit any psychologist or a neurodevelopmental therapist or a developmental pediatrician because हमारा बच्चा दूसरा जो cousin का है उसने 3 साल पे बोलना start किया था, isn't it? So that is a catastrophe that can happen to any of a parent. And in the morning only, Dr. Preeti, I had a call from one of a known to in the relation only, and I saw the child through video consultation last 3 weeks back, and I could feel that there is a concern, there is a communication for sure, there is a problem. And the lady has been calling me today in the morning that we have been still thinking of it because I know my child is having a problem. My husband knows my child is having a problem. But the other associates, like my mother, the grandparents of the children, are like they are blaming me and telling me that you are over anxious. You are making it a big issue. It is nothing. Wait and watch for it. It becomes so difficult for us as psychologists is that to convince we're against a family to save a single child. That is what where you have to do. I just told her that tell them what to do about it. Tell them that at 19 months of age, if my child is not using 20 to 30 words meaningfully, how do I do it? If my child has not been able to do it for 90, once she will shift this authority to them, they will be more responsible. And definitely they are the ones who will push her forward to get an early intervention. That is, I just wanted to add this information and authority parameter to the advocacy and destigmatizing mental health.
No, I think this is great, and you anyway answered the question which I had on this. So to Mr. Sharan, same question, right? How do you make family an advocate rather than a blocker? So there are different ways as shared by two doctors here.
I think Dr. Imran was making some brilliant points. I was just listening to him and on this, as well as the previous thing he was talking.
Thank you.
When it comes to advocacy, definitely the kind of stigma attached to it is not only for the children. I see this a lot at the adults. And more educated people are, I'm seeing this more. I will say that, I'll just reverse, turn the table. I see this problem a lot on the adults who are not coming. Children, they are somehow approaching these days. But adults, they are not. So this question of the stigma and other things are definitely there. We need to take care of it. But I think, how do we handle this systemically? First of all, what I do in my programs and the way I deal with, I had many cases where cases of 7 years, 8 years. Definitely those, some of the clinical cases, once it has been diagnosed, they have already seen it, and then for interventions, they reach out to me. Initially, even I suggest some of the cases that they should go. There is a saying that the human behavior, the tenacity of the human being and the behavior range is very huge, like this, right? And we have so many emotions around here. But sometimes what happens that we can have this, if your behavior is between this and this range, then you're normal, otherwise you're abnormal, right? Now, this range has a cultural aspect to it. Some cultures it is this, some culture it is this, right? And I have seen that people respond to it differently. But having said that, what is happening is the adults, if they are educated about it, that the mental, emotional, psychological, whatever illnesses or can we take it as an opportunity in life? See, for me, I share very openly to people. I personally went through severe depression in year 2000, and I had to resort to medical treatment. Then it happened to me in 2009, 7 to 9. In 2 years I was in med, and my condition worsened. 5 antidepressants and everything was taken. And in that condition, I know what happened to me, how dysfunctional I became. Yes, I was alive, and I was taking treatment. It supported me. But during that time, I knew that somewhere I have to. In fact, today, if you see why I'm here, why I'm doing this work, because I've been working on this for a very long period of time. And I came out and I made it a point that I need to come out. I resigned in 2014 and completely got into this as a matter of mission. I felt that we can come out. And I found out that whatever depression happened, let's look at it slightly from the clinical, away from clinical issues. Life is an expression, let me tell you. If I go to Sankhya Yoga Darshan and other things, It is said the life is an expression, disease is an expression. So whether it is psychological or mental or whatever, this is an expression. Can we take a little time to even understand what life is expressing? And invariably, Krishna, I'm working with many clients. Depressions, right? It is such a tremendous opportunity in life to really look at and convert that as a resource. I have done this. I have modalities for it. And I see how people just turn around. They are no more. They are coming out and sharing now that, look, guys, I was depressed. I went through this and this is what I came out with. This is what happened. This is what I realized. If you look at from the yogic practices, it is the deepest sanskaras that we need to deal with it. And the moment you deal with it, it's over. The whole life starts shifting. I'm seeing the different dimensions of it. Obviously, there is another tremendous support that we have with the modern medicine, which gives you that space, that opportunity. And there are clinical cases where there's absolutely no option. But when it comes to the advocacy and people understanding this, I think people should know that each one of these is a opportunity for us to look at those aspects which otherwise I couldn't understand from my conscious mind. And I am educating this. This is what I'm trying to do. Children, you can't do anything unless we just target the adult group. Let them understand this, that this is something worth handling and there is tremendous reward. The moment they start taking it positively, they will see immediately the opportunity to do the interventions on their child if they are suffering. Right.
No, I think, and that's where the idea of this question and I'll just finish this with Dr. Singh, and then there's a couple of audience questions. So Dr. Singh, again, taking this forward.
Yeah. So
family and advocate or a blocker, and how you make those understand that what Mr. Sharan is asking.
Yeah. So firstly, I will take away from all the panels. I think Dr. Aruna very beautifully said that she's already addressing in her own ways when she has that circle time with the family. I think it's a slight nudge and a slight involvement of the family in the process, and kind of preparing them to what's going to come ahead. That is a big support. It really prepares the family to handle that. And Dr. Imran also said that there's another way that you shift the authority. You give the authority to them and ask them that what is it that how will you do it? And then that's again the responsibility comes over there, and that again helps us to facilitate the process. What I would also want to emphasize here, Krishna, is with mental illness and mental health comes a huge caregiver's burden. And that's basically seen by the family. So as much as they're accountable for a lot of things, they're also going through a lot of their own emotional challenges meanwhile. So I guess one of the way I would like, or I initiate is, I will ask the family, how are you feeling? It's not just about the patient. So if it is a wife who's coming to me, how the husband, it would have come on to the husband. If it is, anyone, significant family member who is not, who's been diagnosed, how the spillover comes, the whole dynamics changes. And we know that mental illnesses are long-term illnesses in some cases, minimum 3 months and 6 months, and a lot of adjustments and a lot of, burden comes over to the caregiver. So it's very important to take care of the caregiver. And I think the empathy there with this little question can be a game changer for us. That we need to know that, listen, you're also going through a lot. Let me help you while you're going through this whole thing. And that support, when that's extended by a clinician and by the doctors, I think that goes a long way with the patient, for that matter, and for the recovery and for the mental health. So then you form a team. So then it's not about like you caused it or you are causing you become the barrier. You're like, okay, we are all collaborating here. And then let's see how beautiful the outcome is going to be. And I guess that's where I want to leave this, this thought with all of you.
I think Dr. Singh, if I just summarize it, like it's like anything in life is not just can be handled individually. And somewhere Mr. Sharan talked about systems. I was reading somewhere in Sapiens, very good book. The human evolution happened when complex systems start working together. So same way, I think this one, the family, though we are, I think, very, very less evolved in mental health awareness and advocacy. I think that's the role we all have to play as an organization, as a person, or as a practitioner. There are two questions. I know we are over time, and I really appreciate you guys, giving so much on a Sunday evening to listen, and it's to their audience. So there are three questions actually, and I will club two for Dr. Noorani. That a 10-year-old boy who only used to see his father after 9 p.m. Now sees his father the entire day due to work from home. What is the mental pressure that the child faces listening to advice every hour from the father? And the second question, which I may not be related, but is autism curable when there is a late intervention for a 5-year-old kid?
Okay, so I'll
Over to you, sir.
the first one. The first question is that he sees father every day now, and father is
He
all the
lives
time
with his father every day, not even
Yeah.
sees it. He lives with him every day.
with his father is like, see, Krishna, it depends on the relationship.
Like my
that
daughter
a
sees
child-
me, so the family is coming in. Go ahead.
So it depends on the relationship that the father has made with his child, isn't it? There are parents who are loving this work from home because they are able to spend time with their kids. Now, the relationship, what we call something in authoritative parenting, is like that it relies on the reinforcements. It relies on not being a helicopter parent all the time. The question there is that all the time I'm commanding him, I'm giving him admonitions, do this, do that, do that. This is a huge disconnect that this child, when he will be an adolescent, he will not be looking back at his father. I would suggest to such a parent is like, look back, observe, and see. Observation is very, very important in parenting. That what is the need, what is the function of my behavior, purpose of my behavior, that I need to pinch him again and again and again. Why my child is doing that? And if you follow that function or the purpose, you will definitely be at peace. Second, yes, the question is quite vague. I'm just trying to fix it in chunks. Like, if I am just pinching him again and again and again, you should not be doing that. This is not a good parenting style, that you'll be always on the head. By this, you are not giving any independency to the child. He will be poor in judgment, making judgments taking decisions on his own. And third is it going to hamper his mental health or not? Again, a question, because we need to have a lot of data for this to understand how is this going to impact the child. I would give him a solution rather than just explaining the questions. Solution is like, make a bond with your child. If you are with the child, whenever you connect with your child, don't push him to do something. Don't tell him not to do something. Tell him what you are expecting, and tell it, maybe you can keep a timing. Okay, this is our time, buddy, we'll be having lunch, then we'll discuss on these two things. यहाँ पे क्या लग रहा है कि जो parent है, the need to communicate to the child again and again tells us something about the mental psyche of a parent. He needs to stop. He needs to come again onto his come to his personality and think that why I should not be going to child again and again. बच्चा जो होता है, बच्चा आपके पास दौड़ के आना चाहिए, आपसे सोल्यूशन मांगना चाहिए, आपसे वो कनेक्ट, इमोशनल कनेक्ट होना चाहिए. Not that you are going after the child and he's running away. If this is the relationship, this is toxic. If this is the relationship, this is quite positive a relationship in parenting. Now, second question is autism. Autism is my is everything mostly I do. And there is a question, there is an error in question. Is autism treatable, or is there a cure for autism?
Yes, it's curable. The question exactly is autism curable when there is a late intervention for a 5-year-old kid?
Autism is not a disease. Please, first of all, on this platform, we are busting this myth about autism, that it is a disease. We need to go to a doctor. He will cure it. He will give the medicines and it will be cured. No, autism is a neurodevelopmental condition wherein a child is not able to process language properly, because the way we are teaching them, they are not able to understand that. Definitely, the whole onus shifts to the parent or the caregiver or the professionals who need to learn the way they communicate, who need to learn the deviant ways and the different ways. This is the whole theme of our discussion today. Destigmatizing mental health, destigmatizing these developmental disorders. Autism is not a disease, it is a neurodevelopmental disorder. Provided good help, provided good intervention, early diagnosis by a multidisciplinary team. The problem is that a child with autism usually visit a single therapist or a single doctor, then they are sent to one place, another place, another place. The holistic management of autism diagnosis should be multidisciplinary, which includes a medical doctor, preferably a developmental pediatrician who is trained for developmental disorders, and a psychologist who assess, an occupational therapist, special educator, speech therapist, who together work for this. After 5 years, what I said is like 0 to 5 years, is like everybody knows 90% of the brain development takes place. 0 to 3 years is a golden intervention for any developmental disorders. It is not that the child will not improve after 5 years. Yes, improvements can be there, but they will be marginal. They might not be as good as could have been before 5 years of age. You should never stop working with your child, because we have seen in our clinical practices, there are good interventions which we have done, and child at the age of 12 years, 16 years, they have been functional. Please don't lose hope. Make sure that they get intervention on continuous basis. Krishna, I'll add to one thing here is like that parents of children with different needs or special needs are usually stressed. They go through a lot of turmoil. It takes a huge toll on their mental health. So what we have to tell them is that please take care of yourself first. There are two things. That is that you have to take decisions intelligently, not emotionally, because we become, as a parent, when once we are diagnosed with a disorder, we become desperate. We visit people who speak good about our kid and they give us some magical cures. For example, in autism, multivitamins, gluten-free, casein-free diets, hyperbaric oxygen therapies, stem cell therapies, these are all not recommended for treatments in autism spectrum disorder. The only recommended FDA treatments are behavioral modifications. And most of the people don't do it because it takes a little more time. It takes an effort on part of a parent. It's a little bit financially also taxing. So we find a shortcut. Don't find shortcuts, because if you are persistent and believe and trust in your child, have that connection, which we just said, connect between a parent and the caregiver is the most important aspect of early intervention.
I think that's very important. I think personally also I learned a lot about it, like, what we treat as a disease and what not. Very quickly, the last question is to Dr. Kalra, and it is about like the level of acceptance. And since you talked about like the whole journey of a woman, so do you see the level of acceptance varies between the people, between teenagers or adolescents versus mothers? Obviously we understand, like, the older the population is difficult for the acceptance piece, but do you see this differentiation or the between a mother who's, let's say, 25-30 or 25 to 35-year-old, or the earlier adolescent girls like 15 to 20? Do you see this difference between them in acceptance of their need of a mental health or awareness about the mental health in their developmental condition?
Okay, so see, again, because Dr. Noorani would be able to tell this better, but I would say that the young girls, which those are my patients, mostly mental illness starts around 15 years of age, when they are having these pubertal changes, and around their body structure change or around either menstrual problem. Around all the behavioral changes are because they feel that they are more responsible towards themselves. They have lots of expectations from parents, and yes, I would say that acceptance is there. They are anxious, they are stressed, and parents are also aware nowadays that their adolescent kids are stressed and they need therapy. So I would say that if I have to compare a lady who's in her 25, 35 years of age, who's going through either pregnancy or postpartum depression, one thing is because we feel that this is more physiological, pregnancy as well as postpartum period, and these changes are very, very natural. And these things which are either breastfeeding or taking care of baby should come naturally to a female, and that is why we do not think that it can cause stress or it can give depression or anxiety to a girl. So those things around that time, family who are the elders like mother-in-law, mother, and other relatives like sister-in-laws and everybody, because they have already gone through pregnancy, postpartum period, and they feel that because they were normal, there is no need, or there's no need of being anxious in during that phase. But mothers and parents nowadays are very, very invested in their kids, and as soon as they feel that kid is not performing well or is behaving a little erratic, from around that age, around 14 to 20, they are more aware. And yes, the girls, parents bring their girls to me, and we suggest that they are going through this psychological phase and they need counselor on a regular basis. So I think they have more acceptance around this subject, mental health.
True that. I will agree with Dr. Kalra that lately a lot of adolescents are coming on their own for the psychotherapy sessions. There is a huge. I got connected with one of the kid. Then they have the huge group, and you know what, Krishna? Almost 60% of that group, I have been seeing them because they are so aware. They speak so well about mental health, taking care of themselves. In fact, there was an argument between a parent and an adolescent in front of me, that an adolescent is like, you are not understanding, mama, that this is a problem. I'm having this, and that kid is just in 12th standard. So thankfully, we should not be that negative about mental health. There is a good awareness, and there's a very good scope that we tap in these adolescents. They are the, as I mentioned, that 40% of our population is them. If we cater to them, they are the ones who are going to be in their early 20s. Cater to them, sensitize them, give them that support, and tell them, yes, you are right. Give them that confidence to stand up for themselves. That is where we can help everybody together as a family.
No, I think this is quite amazing.
Even I would like
how
to
it is
add
changing. Yeah, sorry, Mr. Sharan, you are saying.
I just wanted to add to what Dr. Imran just said, and in fact, I was quite pleased to hear this, because even I recently started getting cases where children have reached out to their parents and please take me to the counseling. You are not able to handle this. Yes. Okay. And that is the kind of cases we have seen. And this is very encouraging. And what happens, as Doctor was saying, that if one, because that peer group, we call it after 14. I mean, we should not stop doing parenting. It's there. They learn from the peers. This is one group. If one person or two person take the help, they spread in their own community. This is natural. It's very natural. They listen to peers, they listen to Google, than their parents. Okay, more than the parents. So that's one definitely. And I was very happy to hear this from Dr. Imran, that this is, you are also observing. Because I was thinking, okay, I may have few cases like this, but now I'm seeing that this is happening. Thank you.
Yeah, I will just add on last thing. Of course, I feel the next generation is way too open to mental health intervention, and they would not hesitate in telling anyone that they're seeking therapy. And I think that's a good news for all of us.
And more power to adolescents.
Absolutely, yes.
No, I think I would like to end it on a positive note. Already statistics are there that 40% people are young. India is a young country. We talked a very somber issue, but very deeply, and I'm really thankful to all of you, not just as a co-founder of Lissun, but from the whole Lissun family. But I think the whole audience and all the people who will watch it even later, the kind of very open and true to the hard discussion that you guys did. You brought your personal experiences. And on the positive note, I think advocacy is increasing, awareness is increasing. We will push to get the higher acceptance, and if not, our kids will do better than us for sure. So with that, I'll close it, and thank you everyone, Dr. Kalra, Dr. Noorani, Dr. Singh, Mr. Sharan, for this wonderful discussion. I know we ran over, but it didn't feel even a minute over to me at least. So thank you. Thanks a lot.
Listen is listening.
Yeah, listen is listening, and I think at least we get the name right, if nothing else.
It is the time to listen to listen.
Yeah.
Thank you very much.
Wow.
Thank you. Thank you.
Thank you.
Thank you.
Thank you. Bye.
Thanks, everyone.
Yeah.
Bye.
Yeah. Bye.